Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the superior vena cava. The superior vena cava is a major vein which drains blood from the upper part of the body. Okay. The superior vena cava is a major vein of the body and drains venous blood, drains venous blood above the diaphragm except the heart and the lung. Formation of superior vena cava. Formation. The superior vena cava, or SVC, is formed by the union of the left and right brachiocephalic vein, formed by the union of the left and right brachiocephalic veins. Brachiocephalic veins. Okay, so this is the left brachiocephalic vein, this is the right brachiocephalic vein. Okay, so this is, we go through that part. 1, right brachiocephalic vein. Number 2, left brachiocephalic vein formation by the right brachiocephalic vein. Okay, that is this, and this is the left brachiocephalic vein. Left brachiocephalic vein. Brachiocephalic vein. This is this vein, left brachiocephalic vein. This is the right brachiocephalic vein. At what vertebral level? At the level of right first costal cartilage. First costal cartilage. Okay, we got formation of SVC, or superior vena cava, by the union of right brachiocephalic vein. This is right brachiocephalic vein. Left brachiocephalic vein. This is left brachiocephalic vein. This is the vertebral, this is the bony landmark, that is the right first costal cartilage is here. We got the formation of the superior vena cava. Now we have to find out the landmarks. Okay, so first of all, the brachiocephalic vein, how they are formed. Brachiocephalic veins are formed by the union of the internal jugular vein, subclavian vein. This is the left internal jugular vein, left subclavian vein. Right internal jugular vein, right subclavian vein. this happens, okay, the brachiocephalic veins are formed by the union of internal jugular vein and the subclavian vein. Okay, behind the sternoclavicular joint. Okay, we got one landmark, that is the sternoclavicular joint. There, formation of the right brachiocephalic vein, left brachiocephalic vein. This is the left internal jugular vein, left subclavian vein, right internal jugular vein, right subclavian vein. Okay, we got one. Then these two veins unite to form the superior vena cava. This is superior vena cava. Okay, so superior vena cava is formed at the level of the right first costal cartilage, right first costal cartilage. This is the landmark for formation of superior vena cava. Okay, the superior vena cava enters the pericardial cavity. This part, this two part, the upper part is in the superior mediastinum. Okay, so we will remember that upper part of the SVC or superior vena cava is a content of the superior mediastinum. Okay, this part is a content of superior mediastinum. How about this part? The lower part, almost half, lower part means the part inside the pericardial cavity. This is the pericardium. Okay, so the part of the superior vena cava below the pericardium is the lower part of the SBC. Okay, of the SBC is a content of middle mediastinum. Remember that mediastinum. Okay, we got the formation at the level of right first costal cartilage. At what level it enters inside the pericardium? Okay, so the upper part, lower part, we can divide by the pericardial perforation of the superior vena cava. Superior vena cava enters the pericardial cavity. So that is the level of right second costal cartilage. Right second costal cartilage. Okay, we got it. We have another landmark is the right third costal cartilage. Okay, so the superior vena cava opens into the right atrium. This is right atrium. The superior vena cava opens into the right atrium. The SVC or superior vena cava opens into the right atrium at the level of right third costal cartilage. We got the sternoclavicular joint, behind it formation of the brachiocephalic vein, right first costal cartilage, formation of the superior vena cava by the union of two brachiocephalic vein. Okay, then the right second costal cartilage at this level, the superior vena cava opens inside the pericardium. It penetrates the pericardium, and also the same level it also receives the, just before entering the pericardium, it receives the azygos vein. This is the azygos vein. Okay, so the SBC receives the azygos vein just before it penetrates the pericardium. The SBC receives the azygos vein just before it penetrates the pericardium. Okay, so this is our azygos vein. This is the right atrium. This is right third costal cartilage level. This is the right second costal cartilage level. This is the right first costal cartilage level. This is the right sternoclavicular joint level. This is the left sternoclavicular joint level. We got the superior vena cava and lemma. How long the superior vena cava is? The SBC is about 7 centimeter in adult male. It is variable depending on the individual physique, but it is around 7 centimeters. Okay. So, what is the characteristic of SVC? The SVC or superior vena cava, SVC, has no valves. Okay, it has no valve. Okay. It is thin-walled in comparison to that of the artery or the ascending aorta. It is thinner. Wall is thin. Superior vena cava is thin. Okay, we got the superior vena cava. Okay, its wall is thin, and superior vena cava is a part of superior mediastinum and a part of middle mediastinum. Okay, what are the tributaries of superior vena cava? Tributaries. Okay, we have the azygos vein. Azygos vein. We have the mediastinal veins. Mediastinal veins. We have pericardial veins. Okay, and we have the formative vein. This is the left brachiocephalic vein. Left brachiocephalic vein. This is the right brachiocephalic vein. This is the right brachiocephalic vein. Right brachiocephalic vein. Okay. Left brachiocephalic vein, right brachiocephalic vein. These are the formative tributaries of the superior vena cava. They form the superior vena cava, so they are also tributaries. Okay. So left brachiocephalic vein, brachiocephalic Tributacephalic vein and the right Brachiocephalic vein. So we got the tributaries of the superior vena cava. Okay, so the superior vena cava, if you take a chest X-ray, it forms the right superlateral border of the cardiovascular silhouette. In the chest X-ray, in the cardiovascular shadow, you will see it forms the right and superior part of the cardiovascular shadow in chest X-ray or cardiovascular silhouette. Okay, right superlateral border of the cardiovascular silhouette in the chest X-ray. Okay, we got that. If we just go at the relationship here, it is on the right side of the superior mediastinal. Then we are looking here. This is the ascending aorta. We have the arch of the aorta here. Okay, then this is the pulmonary trunk. This is pulmonary trunk. Okay, this is the left pulmonary artery, right pulmonary artery. Okay, so from right to left side, we have the superior vena cava, ascending aorta, pulmonary trunk, and its bifurcation. Okay, the superior vena cava also make an impression on the mediastinal surface of the lung, and inside the pericardium, superior vena cava also forms the posterior boundary of the transverse pericardial sinus. Okay, we can say SBC forms an impression on the mediastinal surface of the right lung. Okay, we got one. Another one is that the SBC or superior vena cava forms it is one of the posterior boundary. It forms posterior boundary of the transverse pericardial sinus. Okay, transverse pericardial sinus. It is one of the boundary sinus. Okay, we got the impression, we got the boundary, okay, of the transverse pericardial sinus. Okay, we got that. We got the tributaries. Now we go to the development or embryology. Okay, embryology. Okay, like other blood vessel, it should develop from the mesoderm. Okay, the upper part of the superior vena cava, that is before its entry into the pericardium, the upper part of the superior vena cava or SBC, superior vena cava, develops from the right anterior cardinal vein, right anterior cardinal vein. Okay, the lower part, that part below the pericardium, okay, the lower part of the SBC or superior vena cava forms from the right common cardinal vein, right common cardinal vein, right common cardinal vein. We got the development. Upper part from the anterior cardinal vein, lower part from the upper part from the right anterior cardinal vein, lower part from the clinical anatomy. Okay. There may be chance of obstruction in the superior vena cava above the azygos vein. There may be chance of obstruction below the azygos vein. So if it is above the azygos vein, okay, if the superior vena cava is blocked, we have two ways. We can go to the heart through the azygos venous system. If it is above it, it will return back by means of the azygos vein, the blood from the upper part of the body. If there is a blockage below the azygos vein, then blood from the upper part of the body may return to the heart by means of the inferior vena cava. Okay, there is a possibility. Okay, so superior vena cava may be blocked above the azygos vein, below the azygos vein. Okay, this is one. Another clinical anatomy is that anatomy that is called superior vena cava syndrome. Okay, this happens when there is compression of the superior vena cava. Okay, and the azygos venous system or inferior vena cava may not be active very quickly. So superior vena cava, if it is obstructed, by anything like that of tumor. Tumor means lung cancer, small cell lung cancer, or Hodgkin's lymphoma, or non-Hodgkin's lymphoma. Okay, suppose lung cancer, or Hodgkin's or non-Hodgkin's lymphoma. So what happened? There will be engorgement of the vein in the head and neck region. Okay, there will be engorgement of the vein, engorgement of head and neck veins. That is possible. Okay, that is called superior vena cava syndrome. Also, other signs symptoms may appear: flushing of the head and face, and engorged vein. There will be some headache there. So that's all about the superior vena cava. If you like my video, please subscribe my channel, support my channel. If you have any question, please feel free to ask me. Have a nice day. Bye now.